Hi, this is Jessica Lasowski. I am doing my project on the onboarding experience, the importance of receiving proper training in a new role regarding either new graduate nursing students or if you're transferring from one role to another, being an advanced role or transferring from one unit to another. I really focused my project on the overall onboarding experience with the inclusion of a little bit of continuing education. The setting that I chose was a narrow ICU. It's actually the ICU that I work in at the hospital that I work at. And I chose that setting because I am still a relatively new nurse and I am brand new into the ICU. So I wanted to just take in all I could with my clinical experience to gain the knowledge and more information from other experienced nurses uh, in that unit. I felt it would be very valuable not only for my continuing education, but also to help with my career as an ICU nurse. Um, some of my learning goal really was to team up with my clinical contact was actually the one of my preceptors. I chose her because she had not only a lot of ICU education and experience, she had a lot of experience as a nurse. She has been a nurse for several years. She also took a role in as an educational leader at one point, and uh, I feel kind of a strong pull to the education aspect of nursing. I feel that I would enjoy helping to educate the new field of nurses that come about. So I felt that she would be a really good resource, a really good asset, and someone that could really help me along in my career as well as this project. Her and I had a good sit down talk to determine what my project would be, and I felt that that was really kind of set in stone, that I had made the right decision. Um, some of my objectives. I wanted to analyze the current onboarding experience at my facility and within our uh, healthcare corporation as a whole. I wanted to kind of compare it to other facilities in the area, um, and I wanted to evaluate the need for onboarding and continuing education. I really focused on the onboarding aspect of my project. My my group of new graduate nurses that I went through onboarding with, we were actually the first cohort for the nurse residency program that my company had implemented. So I got a really good experience being not only a new nurse but going through a new nurse residency program that was new to the company. I feel like my experience was valuable. Um, there were some positives, some negatives, and I've spoken in depth with my educational director on the things that I experienced because, of course, they wanted to follow up so they could continue to improve the program as it goes. So those were my learning goals and objectives for this project. There were a few things that I noticed during my clinical experience that really compared to what we learned in the course. One of the biggest things that stood out to me was actually a common theme throughout our entire course was interprofessional teamwork and communication. Um, I feel like it's such a simple concept, but in our field, it is vital that we have team communication and interprofessional communication. Um, when I transferred from my previous floor to the ICU unit, something that was new to me was this rounding that happened every morning on the unit, or I guess every shift, but I'm day shift, so it happened every morning. It would be the manager, one of the nurse managers, someone from the pharmacy, someone from case management, someone from dietary, a representative from the therapy department, and sometimes multiple people, maybe a physical therapist and a speech therapist. Um, Several departments were represented in this rounding that would happen. This group would come around to each nurse and get an update and report on what was going on with our patients that we had for the day. They would want to know anything that we needed, anything that was new. They also followed up on things like what what the plans for the patient were, the treatment plans, what their discharge plans were, and of course, current things that were going on with the patient. Like dietary wanted to know, had they been consulted? Did they have a diet in place? Was it the right diet? How was the patient tolerating it? Um, I work on and did my clinicals on a neuro ICU, so we had lots of stroke patients. So during this rounding, a lot of speech therapists typically came into the roundings with the group, and uh, her and dietary worked really close together because a lot of these patients had to have swallow studies done to determine if they were able to eat. If they were not able to eat, how were we going to um, feed these patients and make sure that they were receiving their daily caloric intake needs. Um, but this was a new concept to me, and I noticed during our class, during our studies, that it was a common theme amongst a lot of the stuff that we read. Um, our own Kelly book discusses. There was one quote that discussed how clear and open communication um, was an effective technique in interprofessional teamwork that could counteract potential for human errors of judgment. Um, and I feel like what was really great about this rounding and this team collaboration and communication was that it there was that discussion of what the current situation of the patients was, and um, every person that was in the team was on board. So everyone knew what was going on with the patient. Any questions that were needed could be answered at the time. So everyone was currently up to date. Like I said, it was a stroke unit, so um, it could have been a situation where dietary recommended regular diet. Physician may have said, okay with whatever dietary recommends, and then the nurse could say just order regular diet. And this is someone who couldn't swallow, so that could be a potentially fatal error if the person aspirates. And I felt that it, I really enjoyed learning about how something that I just saw as, oh, something they did on the ICU is something that is one of the best practices that we are learning in this class. Um, Another thing that was discussed in our class was the use of an SBAR, which is the discussion of situation, background, assessment, recommendation. Our our company as a whole um, is really pushing the use of the SBAR. There is a link to it in our computerized system, and every time we give a report, we are monitored and tracked um, to not only do we have to document when report was given, um, it is also shown if we actually click on this SBAR link um, when we give report to the oncoming nurse, so that we can go through the entire situation, the background, the assessment, and our recommendation, any recommendations that are in there. And I feel that it is a very powerful tool to have to be able to be most up to date on what is going on with the patient. A lot of things can fall through the cracks, and it is not a fail-safe system, but I feel it's a great system to utilize in order to um, pass on the information, so to prevent some of these things falling through the cracks, and as the quote said, counteract the potential for human errors and judgment. The onboarding process with my company really reflected several of the best practices that we've learned in the course. The process itself is a year-long program where monthly The cohort would meet at different locations with different leaders, different departments, and every month there would be one or more subjects discussed. And there was an open forum at the end of every single meeting, and there was constant open communication between the nurse residents and the residency leaders. One of the things that actually they pointed out in our nurse residency is that they feel that nursing retention rates can be very low. So they thought this program would be a great way to meet all of the needs of a new graduate nurse, discussing the different experiences that they may encounter, and just kind of giving each nurse a resource. And a contact in different departments. So when the nurse, once they completed their first year, they felt that they had a good breadth of knowledge regarding different areas, as well as more tools in their belt, and they didn't feel um, so unaware of what else was going on in the company, and um, they would just be able to broaden their horizons, so to speak. One of the articles that I read was a 9-year study by Slate, Stavarsky, Romig, and Thacker. It discusses how nurse residency programs for onboarding are now the gold standard um, to support the transition of the new nurse into practice. And it is essential in nurse retention. I know there is a concern for big nurse turnover. Um, and like I said, this program really just focuses on meeting the nurse's needs. Another aspect was, like I said, there were different leaders that came to all of these meetings, meeting with us, introducing, um, being a face instead of just a name we read or learn about. And they really, at the end, with that open discussion forum, we were able to discuss any concerns, issues that we had, and that was a good way for us to realize that um, we are important as new nurses, and they really care about our not only our current career but our continuing career in education. Um, and this was discussed in the article by Melnick regarding high reliability organizations, talking about how one of the key concepts was leaders listening to insights of other staff members, um, including patient care technicians, nurses, even family and patients. And I feel that learning, going through the onboarding and learning about the onboarding process, I really got to see that component and that concept being put into action. The last thing I saw that we actually learned about in our Kelly book was this interprofessional education. In each class, we had different departments come and meet with us. We met with the chaplain. We met with even down to part of the human resources department that takes care of some of our uh, they do some of our healthcare programs, and different programs that our company offers that we may not learn. And our book talks about how it's the opportunity for multiple healthcare disciplines to learn together in the same learning environment. So what's great about this is we're all in this meeting, during these gatherings together in the same environment, having these open discussions, and we can really feel like we're collaborating with one another. I really feel that the onboarding experience I went through and looked into really met these best practices that we learned in class. Overall, I feel like I had a great clinical experience. I really enjoyed the entire class and learning um, all of the best practices that we discussed. And I appreciate everyone and all of your help and everything. Thank you.